Since the start of Russia's invasion, many pregnant women in Ukraine have had to give birth in places they would have never expected, from the inside of subway stations to bomb shelters. Morning Joe reporter Daniela Pierre-Bravo has more on the country's rise in premature deliveries.
Pregnant women who are forcibly displaced from their homes, and that including refugees, are often facing a tremendous amount of physical and mental stress.
The United Nations Population Fund estimates 80,000 Ukrainians will give birth in the next 3 months. As the conflict in Ukraine escalates, expecting mothers and newborns remain among the most vulnerable. Magda Dutch is a consulting psychiatrist in Warsaw, Poland, and treats new mothers as they cross the border from Ukraine.
They're traumatized with their experiences. They often speak about days or even weeks they had to spend in shelter, in bunker. They are also terrified of what's happening to their families who are left in Ukraine.
Displacement and the stress of war, putting many of them in danger of high-risk pregnancies.
The immune system is directly connected to the stress axis and the stress hormones. So when we have a situation in which the patient is very, very stressed and traumatized, the risk of preterm birth is higher. So during the last month, among the Ukrainian refugees, we had seen an increase in preterm births and in stillbirths. In the conditions that we hear are right now in Ukraine, in many hospitals, there is an increased risk of infection, even a direct trauma, which may also cause a preterm birth.
Those conditions include war-torn medical facilities. The World Health Organization confirming over 100 attacks on health facilities in Ukraine since the start of the invasion. From Mariupol, Kharkiv, to the northwest city of Zhytomyr. Dr. Irina Kondratova, a medical director in Kharkiv, telling the BBC that premature births have increased threefold and account for half of all deliveries at her prenatal clinic. Sadhana Sodnajamurthy is a medical officer for AmeriCares, an aid organization that has deployed over 20 tons of medical supplies to Ukraine since the start of the war.
There's also the aspect of there's disruption to antenatal care. So their routine checks that they normally go through, right, during the pregnancy, and especially women who have some kind of underlying disease like hypertension or diabetes, who need even more frequent visits, are not having any of that. And so you have these either undetected or untreated conditions that are further complicating pregnancy, and all those conditions can lead to preterm birth.
And with an increase in complicated pregnancies comes a need for greater specialized care.
Babies that are born premature, their lungs tend to be not as well developed, and so they often need quite a bit of breathing support. We need things like breathing circuits and CPAP machines, incubators, lung surfactant medicines that can help support newborn breathing after a premature birth.
Life-saving medical equipment needed in hospitals that are already severely strained, and in some cases, gone altogether.